Hi, psychology students. I want to go through real quick with you before you make a selection on the AP Psychology project that's coming up for abnormal psychology. I want you to just kind of take a little bit of time to think about the project that you choose before you make that decision. So this next two chapters will be both abnormal psychology and the treatment of abnormal psychology. So in between those two chapters, you are going to choose a topic that interests you. Tell us about the project or the topic, and then you're also going to explain about a case study and the treatment of it. So as we explore psychological disorders, I want you to do an infographic presentation. I'm going to put these up, and you've maybe noticed over the years that they've been up around the school. What we need to realize is that psychological disorders are not necessarily a stigma, but people don't probably know enough about them. I hear a lot of people talk about that or joke about a mental illness, and they really maybe don't understand what it is. So I think it's partly our job to help inform what mental illness looks like, what it doesn't look like, and those unique times when treatment maybe didn't work, or the case studies that really zone in on a certain disorder. So you may choose any psychological disorder or illness that we discuss in class, or any one that might interest you. I would like you to take a look at Haiku. There's a little tab on there on abnormal psychology that says DSM-5 Diagnostic Criteria Codes Chart. If you open that up, there are a lot of disorders, a big list of disorders that you can choose from. Be aware the more obscure the illness, the more difficult it might be to find research or information. By the same token, very common disorders will have a vast amount of information, and you may be overwhelmed with information that can be contradictory or confusing. These are a few probably of the best resources to get you started, and then you'll need to find other reputable sources to continue your research. The content to include is just the history of the disorder, basically when it was first noticed and observed, who named it, the symptoms and the behavior, the treatment, and then a case study. So this is the basic criteria that we need. So there's 5, 10, 15, 20 points you can see. The appeal, the visual appeal and the creativity appeal is going to be quite important, because you need to draw in the viewer's eye. And so if you make it dynamic and make people want to look at it and want to find out more about what it is, that's a real service. That's a real public service. So make it visually appealing. The mechanics obviously have to be good. I need a bibliography, and I don't want just sources on the back. I want to see a bibliography on the back side. And then the oral presentation. This is hard for some students, and we need to practice it. And so we'll practice it in front of the class. So you need to present this, be well prepared, make good eye contact, understand what your disorder really, what your topic is, and understand that I'm going to probably be firing some questions back at you for clarification. So you don't just want to know what's on your infographic. You want to be ready for follow-up questions from me or other classmates as well. Students in the same section will not be allowed to have the same topic. Therefore, you will use a Teams form to select your top choices. That should be on Haiku. I think I did it right. If there's a conflict between topics, students with the higher GPA in class right now will get their first choice. There's not really a good there's really not a good way to do this, and if a lot of people are interested in, say, bipolar disorder, and there's 4 people who want to do it, and there's only one, we don't want to hear the same presentation over and over, then it's going to have to go to the person who has a higher GPA right now in the class. So take a look at that listing of disorders. This is not going to be due until the 19th of March. The presentations won't begin until the week of March 22nd, but I just wanted to make you aware. All right, talk to you later. Bye.